Welcome back to Health Bulletin. Today, we've got a global health roundup that you simply don't want to miss, from alarming trend in heart attacks among the young to breakthroughs and challenges in weight loss, infectious diseases, and mental health. First up, we all are seeing a startling trend that more young people are now experiencing heart attacks like never before. A 22-year-old gym influencer dropping dead mid-workout, or a 30-year-old tech CEO collapsing at his desk, and a 19-year-old athlete suffering a cardiac arrest on the field. It's no longer just an old person's disease. Now, recent studies have shown that heart attacks in adults under 40 have been increasing by about 2% each year. And in India, a quarter of heart attack patients are now under 40, which is double what it was 2 decades ago. So what's behind this silent epidemic? Well, doctors point to 5 major triggers, and some of which might surprise you. Number 1, ultra-processed food. Your daily protein bar, caffeinated energy drink, and your evening snacks, either it's deep-fried or noodles. In a 2023 BMJ study, found people eating ultra-processed foods have a 24% higher heart attack risk. And if you think ultra-processed food is such a big deal, actually, they're packed with seed oils, hidden sugars, and inflammatory additives that wreck your arteries constantly. Number 2, chronic stress. Work pressure, financial stress, and social media overload keep your body in fight-or-flight mode, flooding it with cortisol, a hormone that increases blood pressure and hardens arteries. Number 3, sedentary lifestyles. Sitting for 8+ hours a day doubles heart disease risk even if you exercise. Due to poor circulation plus muscle atrophy, cause a sluggish heart. Number 4, sleep deprivation. Yes, sleep deprivation is the underrated threat. If you are getting less than 6 hours of sleep, then you're a high risk for heart disease. In fact, according to a study published in the European Heart Journal, sleep deprivation is linked to a 48% higher risk of heart attack. Your heart repairs itself during deep sleep. Skip that, and it's like driving a car without ever changing the oil. And number 5, undiagnosed genetic risks are all major culprits. And now it makes you wonder, what can you do to protect yourself? Here is 5 life-saving hacks. The good news: 80% of heart attacks are preventable. Here's how to bulletproof your heart. Number 1, the 30-second daily check. Press 2 fingers to your wrist. If your resting heart rate is above 80 BPM, it's mean your heart's working too hard. It's time to de-stress and move more. Number 2, the 5-5-5 meal rule. It means your every meal should have 5 grams of fiber, 5 grams of protein, and 5 grams of healthy fats. Think of avocado, nuts, salmon. Such combo keeps arteries more flexible and blood sugar stable. Number 3, a 2-minute desk workout. Every hour, take 2 minutes to do squats or jumping jacks. This prevents blood pooling and boosts blood circulation. Number 4, wear blue light blockers at night, plus keep your room at 18 degrees Celsius. Cooler temperatures promote deeper sleep, which leads to a happier heart. Number 5, ask your doctor for an LPA test and a calcium heart scan. These tests typically cost less than $100. Could they save your life? Remember, heart attacks don't care about your age, your gym routine, or your diet fads. They strike silently. But you have the power to fight back. Start today, get tested, move more, sleep better. Next, let's talk about a breakthrough with a twist. Eli Lilly's weight loss drug, Mounjaro, was launched in India at a significantly lower price than in the US. It promises benefits like weight loss, controlled blood sugar levels, and a lower risk of obesity-related diseases. But here's the catch. Despite the lower price, it may still be out of reach for many Indian patients. With monthly costs adding up to around $14,000, it's a tough pill to swallow for the average person, especially when most of these drugs are purchased out of pocket. Meanwhile, patients are eagerly waiting for alternatives like Novo Nordisk's Ozempic, though its launch timeline remains uncertain. Now, over in Southeast Asia, we have more concerning news from Cambodia. A 3.5-year-old boy from Kratie province has tragically become the 3rd human death from H5N1 avian influenza this year. Since 2003, Cambodia has recorded 75 cases of human infection, including 46 fatalities. While H5N1 remains largely confined to birds, its ability to jump to humans, albeit rarely, but this serves as a reminder of the potential for these viruses to trigger a global health crisis. Now let's talk about something you might have seen on your favorite social media app, ADHD awareness. With more and more Americans suspecting they have ADHD, platforms like TikTok have become a hub for sharing symptoms and advice. While it's heartening that so many are finally getting diagnosed after years of struggle, but research shows that only less than half of the popular claims these videos accurately reflect the scientific criteria for an ADHD diagnosis. There's a growing call for clearer adult ADHD guidelines as we navigate the fine line between raising awareness and spreading misinformation. And finally, as we mark 5 years since the WHO declared COVID-19 a pandemic, it's worth reflecting on how far we've come and what we still have to learn. Early on, many experts predicted that the virus wouldn't mutate much, but as we've seen, the coronavirus has made evolutionary leaps, leading to multiple waves and variants. Researchers have figured out ways to slow the spread of the SARS-CoV-2 virus with masking and air filtering. They've developed safe treatments and vaccines, and they've tracked hundreds of thousands of different mutations and how those mutations evolved. And now we know something else, because if you remember, in March of 2020, a lot of scientists predicted that the coronavirus was not going to evolve very much. Early in the beginning of the COVID-19 pandemic, scientists predicted the coronavirus would mutate slowly. They were wrong as pandemic progressed. Hundreds of thousands of viral mutations and multiple seasonal waves later, researchers now know why. And we know what actually happened, which is that in the winter of 2020, we sort of got this first big variant, what was known as alpha, and then we just kept getting more and more variants. The coronavirus continued to mutate to make these evolutionary jumps that helped it survive. And for a long time, scientists didn't know why. Turns out, SARS-CoV-2, the virus that causes the disease COVID-19, was making evolutionary leaps and bounds in one specific group of people. When the virus jumps from person to person, it gets about 2 mutations a month. According to a recent paper in February, scientists comparing several studies indicating that in the immune system of an immunocompromised person, the SARS-CoV-2 virus might survive for weeks, even months. The more time you have, the more mutations you can accumulate. It's almost like a training camp for the virus to find ways to hide from our immune system. In other words, the virus has the opportunity to try out different mutations against the human immune system. Those mutations, in turn, develop new variant, which may help it spark a new wave of infections. That's almost certainly what happened with Omicron. Now, such understanding, it could help us predict the evolution of other viruses in the future. This journey has not only challenged our healthcare systems, but also reshaped our understanding of viral evolution. It's a stark reminder that the next pandemic could be just around the corner if we're not vigilant. If you found this update as insightful and essential as I did, be sure to like, share, and subscribe to Health Bulletin for more updates on outbreaks, breakthroughs, and everything shaping our future.